If you're a full arch dentist talking to patients all day long about full arch implants and all on four, there's one question that I bet you dread getting. This question especially hurts when you get a perfect patient who's an ideal candidate with tons of bone. You know you can transform their lives. You can already imagine how amazing the before and after pictures are going to look. You can practically feel the hugs and tears of joy from the patient when you finally reveal their final smile. But there's just one tiny obstacle, the dreaded question when the patient says, okay, doc, this all sounds amazing, but how much is this going to cost? And how you answer this question is the difference between another $60,000 case closed and another life transformed, or just let me think about it and I'll get back to you. And my name is Dr. Michael Ling, and on this channel, we talk exclusively about marketing and case acceptance for full arch implants and all on four. First of all, here's how most dentists handle this situation. When the patient asks, how much does this cost? The dentist, or more likely the treatment coordinator, just tells them how much it costs. And it sounds pretty straightforward. They asked how much it costs, so I told them how much it costs. But if you listen to a lot of staff, especially inexperienced staff, quote fees to patients, they often do it in a really timid manner. These are $60,000 cases. Most of our staff members don't make $60,000 in the entire year. So they'll say something like, it's, I don't know, like around $60,000 or so. They're certainly not confident when they're presenting these numbers. Or they'll start to backtrack right away. They'll say it's like about 60,000, but no, there's cheaper ways. You could do it for 40,000, or you could do overdentures. They're only $20,000. They're a lot cheaper. And no matter what your fee is, whether you're doing $15,000 arches or $30,000 arches, the patient is going to feel sticker shock. They're going to hear that number and think in their minds, oh, wow, that is so expensive. And that number is going to be the only thing on their mind for the rest of your consult. Because when you just state a number like $60,000, the patient's brain has no context. There's nothing for them to compare it to. Most people don't have any idea what dentistry costs. They do know what a car costs. They do know what a car costs, and a down payment on a house costs, and college tuition costs, and a TV costs, and a vacation costs. These are all things that we know what they cost. But dentistry, especially all on four and full arch implants, patients have no idea. So when you say something like, oh, it's going to cost $60,000, what they're thinking in their mind is, number one, wow, that's really expensive. And number two, they're starting to compare it to other things. They're starting to think, $60,000, I could buy a new truck for $60,000, or I could put my two kids through school for $60,000. There's no way I'm going to pay that much for my teeth. Or you'll get patients who do have some idea, but they usually have a number that's way too low. Typically what happens is the patient has a neighbor whose cousin got all on four done in Mexico about 10 years ago, and he remembers them saying something about it cost them like $20,000. So they're thinking 10 years later, plus getting it done at home instead of Mexico, maybe it'll cost me $30,000 or $40,000 instead of $20,000. So if they come in thinking that it's going to be $30,000 or $40,000, and you tell them it's going to be $60,000, of course they're going to experience sticker shock. So here's another method that I see some other docs doing, and this is the restaurant menu method. The patient asks how much does it cost, and the dentist or the treatment coordinator starts to rattle off a whole list of menu items with the fees. How much is it? If you did an upper and lower denture, it may cost you $5,000. If you did an upper denture and a lower overdenture, it may cost you $20,000. If you did an upper denture and a lower all-on-4, it might cost you $30,000. If you do upper all-on-4 and lower all-on-4, it might cost you $60,000. So which one of those do you want to choose? And of course, this method often backfires too, because there's no comparison between option one and option two, aside from how much money it costs. And if you're really giving the patient an option between a $60,000 upper and lower all-on-4 solution or a $20,000 overdenture solution, you just made your all-on-4 feel so much more expensive, which is the opposite of what you're trying to do. So doing it that way is fine if you want to do a lot of overdenture cases. But this channel is for full arch implant docs, and we want to do more arches. So today I'm going to give you the exact framework to answer the how much does it cost question with confidence. It's a method based on the anchoring principle. that ethically frames your fee, eliminates sticker shock, and makes even a $60,000 or $80,000 or even $100,000 treatment plan feel like good news to your patient. The anchoring principle is a core foundation of the Practice on Fire philosophy. The way it works is that any treatment option we present to a patient is very heavily influenced by the information that immediately precedes that treatment option. Here's an example from outside of dentistry to demonstrate how this anchoring principle works in real life. Imagine you were going to buy a new house and you enlisted the help of a real estate agent who was going to take you around the neighborhood to show you some different houses. That agent is not going to show you just one house. They would never say, okay, Mr. Jones, you said you wanted to buy a house. Here's a house. Do you like it? Do you want to buy it or not buy it? That would be crazy because there's no comparison. There's no context. Instead, what the real estate agent will do, take you around to multiple houses. And a smart real estate agent will choose very specific houses to show you and show you them in a very specific order. So here's what the best real estate agents do. Once they get to know you and understand what you're looking for, they identify a house that they think checks all your boxes and you're going to be thrilled with. But they don't show you that house first. First, they're going to show you a different house that's way more expensive than your dream house. And it's only a tiny bit nicer. It's a little bit bigger. Maybe the yard's a little bit nicer. The finishes are just a little bit nicer. Just barely better. And then after seeing that house, they take you to what they think is going to be your dream house. And now that second house feels like a much better value. You can't help but think to yourself, wow, I can't believe this house we found. It's so much cheaper than that first house we saw and is almost as nice. We'd have to be idiots not to buy this house. What an amazing deal. And that's exactly what the agent wants you to think. If they had just shown you that second house and no other houses, you wouldn't feel like it was such a great deal because you have no context and you have no comparison. Another example of the anchoring principle that we see all the time is when you go to the restaurant and want to order a bottle of wine. Now, admittedly, I don't know anything about wine. So if I went to the restaurant and I said to the waiter, yeah, I'm feeling like a bottle of wine tonight, the waiter would never say, okay, Mr. Ling, here's a bottle of wine. It's $100. Would you like it or not? If they did it that way, they get a whole lot of people saying, you know what, never mind about the wine. I'm just going to have a Diet Coke instead. Because if you show me a bottle of wine, it's $100, I think, wow, that's really expensive. I don't need the wine. So that's not what the restaurants do. Instead, they give you a printed wine list with a whole bunch of wines on it. And some of those wines are super, super expensive. On this wine list here, there's a bottle for $800. And I don't think they sell very many of these $800 bottles, but that item on the menu still serves a purpose. So if I'm out for dinner and I just want an everyday, regular bottle of wine to go with my meal, I might think to myself, I feel like a white tonight, and I'll probably order something. If I look at these prices here that range from $55 to $130, I'm probably thinking to myself, I'll probably order something like maybe in the $60 to $65 range. And again, I don't know what these wines are. I'm just picking that number because of where those numbers sit relative to the other prices. And if I came back to that restaurant on another night and I was celebrating something really special, a special occasion, a holiday, an anniversary, I might want to splurge and buy a more expensive bottle of wine. And on those nights, I might buy something in the $200 to $300 range. Because in my mind, what I'm thinking is these $60 to $100 bottles, those are probably like your everyday wines. These $800 bottles, that's like your rap star wine. So if I want something nice and high-end, but not extravagant, then I'll probably spend in the $300 to $400 range. And these decisions are all strictly made on pricing. The implied value of these wines, because of where they're positioned relative to other wines. So how do we apply this knowledge to presenting fees for all-in-4 and full arch implants? When a patient asks us the how much does it cost question, we don't answer the question yet. Before revealing our fee, we first present another option that's even more expensive and less desirable. This is what we call an anchor, and this anchor acts like the expensive bottle of wine on the wine list, or the really nice home that's way out of our budget, but the real estate agent shows us anyways. The best way to illustrate this is to go through some clinical examples that we full arch dentists deal with every single day. In this example, our treatment plan is an upper and lower all on four. If the patient were to ask, okay, doc, that sounds great, but how much is this going to cost? We're going to fight the temptation to tell them, oh, Mrs. Jones, it's going to cost you $60,000. Instead, we're going to answer that question using the anchoring principle, and it goes something like this. There's a couple different ways we can do this. The traditional way is to place 8 to 10 implants per jaw from cheek to cheek, and then you get white porcelain teeth that are secured to those implants. It looks amazing, super strong for chewing, feels natural, and lasts a long time. But there are two major downsides to doing it this way. First, it's often done in multiple stages, so you get your teeth removed first, then wait 4 to 5 months for it to heal, then place the implants, wait another 4 to 5 months for healing, and then finally attach your teeth to your implants. And during that healing time, you'd have to wear a regular loose-fitting denture, which is usually the worst part of this entire process for people, because the people who go through with this kind of treatment are usually doing it to avoid dentures. So we've set a pretty strong anchor so far. We haven't told the patient what it's going to cost. First, we're describing another option, another way of doing it that's way less desirable than the way we're about to show them. The second downside is that you don't have enough bone for 8 to 10 implants, which doesn't mean you can't do it this way. It just means you need bone grafting first. This means you need to see the specialist, sometimes need multiple rounds of bone grafting over a period of 6 to 12 months, and then you're ready to get started. And by the time you pay the specialist and you pay me, you could easily end up spending over $100,000. So that's our anchor. That's our expensive bottle of wine. The other way to do this is a more modern approach. Using advanced techniques and specialized implants, you get the same outcome. It still looks amazing, feels natural, it's rock solid for chewing, and never needs to be removed. But now you only need 4 implants. And the good news is you do have room for 4 right now. You don't have room for 8, but you do have room for 4, which means you can skip the specialist and we can do the whole thing for you right here. You don't need any bone grafting and you can get started right away. You never have to wear a loose denture because you'll get permanent teeth that same day. And because it's far less time, less visits, and less surgery, the cost is lower as well. Instead of spending over $100,000, now you're in the $60,000 range. Does that sound like a good plan? So what we've done is anchored our treatment plan of upper and lower all in 4 to something that is more expensive and less desirable. In this case, I anchored the patient to the old way of doing full mouth implants, which meant bone grafting, more implants, a delayed load, and of course a higher fee. And that makes the second option, the upper and lower all on 4, at $60,000, feel like a much better value than if you had just told the patient, your treatment plan is going to cost you $60,000. In this example, the treatment plan is the same. It's still upper and lower all on 4. In the first example, the anchor that I used was the old way of doing full arch implants. But in this example, I want to use a different anchor just to show you how this works. And the anchor is going to be if the patient doesn't have enough bone. It's a very similar concept, but just a little bit of a different twist on it to show you how this works. So the patient asks, okay, doc, how much is this going to cost? And our answer is going to be, what we worry about, especially in people who have missing teeth for many years, is that they often don't have enough bone, which doesn't mean you can't get it done. It just means you need bone grafting first. This means you need to see the specialist, sometimes multiple rounds of bone grafting over 6 to 12 months, and then you're ready to get started with implants. And by the time you pay these specialists and you pay me, you could easily end up spending over $100,000. That's our anchor. But if you do have enough bone, then you don't need any bone grafting. You can skip the specialist, extra surgeries, and we can do the whole thing for you right here. And because it's far less time, less visits, and less surgery, the cost is lower as well. So now, instead of spending over $100,000, you're probably in the $60,000 range. Does that sound reasonable to you? And you can imagine if you had this conversation earlier in the consults, before you really dive deep into the scans and the cone beam, Now, for the rest of the consult, the patient is no longer wondering the entire time, oh my God, I wonder how much this is going to cost me. Instead, what they're thinking is, wow, I really hope I have enough bone and that I qualify for doing this without the bone grafting, like the doctor said. And that really changes the tone of your consult. You're not selling them anymore. They're not sitting there afraid to be sold to. Now they're sitting there hoping that they qualify and that they're lucky enough to get this done. The first two examples were upper and lower all-on-4 cases. This treatment plan is a little bit more complex, but the anchoring principle is versatile. You can use it in literally every clinical situation. So for this example, your treatment plan is an upper FP1 with bilateral sinus lifts. And it can be really tricky to tell the patient this treatment plan and make the patient feel good about it, because now it's even more expensive than all-on-4, and it's more involved. And now you have to do sinus grafting. All these things can be really scary. So the way that most dentists would answer the cost question for this case would be, your case is a lot more complicated because we need extra implants. We need to do some bone grafting in your sinus. It's going to take us longer. So the regular way we do it is like $30,000, but your case is going to be like $40,000. And that doesn't sound like good news. I don't know how a patient would feel good about hearing that. So how do we make this treatment plan sound like great news to the patient? Using the anchoring principle. Before revealing our fee for this case, we're going to first introduce another way of doing it that's even more expensive and less desirable. And I would do it something like this. How much does it cost? Well, that's a great question. The cost depends on exactly which approach we take. The problem we have in your situation is that you've lost so much bone from wearing that denture for the past 20 years. And if you lose too much bone, then there's sometimes not enough bone at all to do implants in your jawbone, which doesn't mean you can't get implants. It just means we have to find extra anchor points in other parts of your skull. For example, oftentimes these patients with extreme bone loss end up with implants that anchor into the bone around their eye sockets. Of course, these patients end up seeing the specialist, and there are additional risks. And by the time you pay the specialist and then pay me, you could easily spend $70,000 just for your top teeth. That's our anchor, the $70,000 and the quad zygoma. And how thick you lay it on is up to you. You can make quad zygomas sound like the worst thing ever. You can make quad zygomas sound like the scariest, worst thing ever to make a really strong anchor. But of course, you don't want to go overboard and be overdramatic and use scare tactics with your patient. But let's continue the conversation. After you present the anchor, pause a beat, let that soak in, take a breath, and then continue. The good news is you haven't lost that much bone yet. If we move quickly, we can take advantage of the bone you have right now and add a little bit where you're short. That way, you don't need to see the specialist. We can do the whole procedure for you right here in our office. And most importantly, you can skip the eye socket implants. And because it's a less invasive surgery, it also costs you less. Instead of paying in the $70,000 range, your fee will be $40,000. So that's how I would make an FP1 with bilateral sinus grafts sound like great news, because at least the patient doesn't need quad zygos that would cost them $70,000. When we first present the more expensive and less desirable solution, the quad zygos at the specialist that cost 70 grand, it makes our proposed solution feel like a much better value. Let's look at one last example. In the previous example, we made quad zygomas sound like the scariest, most expensive procedure ever because we use it as an anchor for the FP1 case. But what happens if quad zygomas are your preferred treatment plan? How do you make quad zygomas and those eye socket implants that are going to cost you $70,000 sound like a great idea? Here's exactly how the patient asks, how much does it cost? And we're going to answer, the cost depends on exactly how you want to do this, because there's not just one way to get you rock solid, non-removable teeth so you can chew your steak and finally get rid of your dentures. The challenge in your situation is you just don't have any bone left to support regular implants the way that most dentists do them. To do this properly, you need specialized implants that only very few dentists have experience with. And if you lived anywhere else in the state, you'd probably have to fly back and forth to the big city for multiple visits, and you'd pay big city prices. And you can insert the name of whatever the big city is in your area. I have a good friend who lives in this city, and if you were a patient of his, you'd pay north of $90,000 for this. Not counting your travel time to and from the city and all the time away from work and your family to make all those trips. And that's our anchor. We pause, let it soak in, take a breath, and then continue. The good news is that you have the option to do this right here in Burlington. You're lucky that Dr. X is one of only a few doctors in the entire state that can handle this case, and it's right in your backyard. That means you don't need to fly back and forth to the city. You can also save costs because everything in the city costs way more than it does here. Dr. X will be able to help you from start to finish right here in our office, and instead of costing $90,000, you'd only pay $50,000 for the exact same thing. Does that sound reasonable to you? Quad Zygo is a huge treatment plan that comes with a massive price tag. And if we want to avoid sticker shock, then use the anchoring principle. Before revealing your fee for the case, first introduce an alternative solution that's even more expensive and less desirable. And then when you do present your treatment plan, the patient's much more likely to feel like it's great news that they need Quad Zygo, but you can do it for them right here. They don't have to travel to the city. They don't need to pay the big city prices, and they can deal with you, the doctor they know and trust. Plus, save tens of thousands of dollars. Plus, we've shifted the focus from spending $50,000 to saving tens of thousands of dollars. So to summarize this message, here are 4 reasons why the anchoring principle is so effective when answering the how much does it cost question. First, it reduces sticker shock. The rule of thumb is if you're going to present a fee to a patient, the first number out of your mouth should not be your fee. The first number should be a higher fee from a more expensive and less desirable way of doing it. And by presenting that higher fee first, not only does it reduce sticker shock, but it also shifts the focus from price to value. We're doing full arch implants. Every treatment plan that we do is expensive. The cheapest thing that we do is still thousands of dollars. Our typical treatment plan is going to be in the tens of thousands of dollars. There's no way around it. It's very expensive. But expensive doesn't mean people are not going to buy it. People buy expensive things all the time. By using the anchoring principle, what we're doing is shifting the focus from how much it costs to how much they're saving if they were unlucky and had this other situation that was even more expensive. Thirdly, using the anchoring principle builds authority and trust because we're showing the patient multiple options. We're not just giving them one thing and saying, you have to do this, take it or leave it. The patient doesn't feel like they're being pushed one direction or the other. And the great thing about this method is that we're guiding them away from the most expensive option because our preferred treatment plan is cheaper and easier than the first option. And that's a great way to build trust with the patient. And that's a great way to build trust with your patient, is to make them feel like you're not always just guiding them to the most expensive thing on the menu. And lastly, the anchoring principle simplifies decision-making. We want our patients to leave our office with a very clear picture of not just what their options are, but which option is very clearly the best one for them. And the anchoring principle does that by highlighting the specific pros and cons of the different options in a very specific way to make the preferred option feel like the obvious answer. If you're doing this properly, the patient's thinking in their mind, why the heck would anybody choose option 1? The second one is obviously way better and way cheaper. That's the one that I want. And they're no longer thinking, wow, that's super expensive. I think I should get a second opinion. I'm going to price shop this to see if I can get a better deal. So try this framework out the next time you get the how much does it cost question. You're going to reduce sticker shock. You're going to shift the patient's focus from the cost to the value. Trust and authority, simplify the decision-making, and as an added bonus, reduce price shoppers and discount seekers. I hope you found this content valuable. Please subscribe, give us a thumbs up, or comment below, and that'll help us make more videos on full arch implant marketing and case acceptance.